Okay, I'm Wouter Oosterink. I'm a cardiac surgeon in Leuven, Belgium, and I have been active for quite some years, mostly into coronary surgery, focusing a lot on robotic coronary surgery, which enables me to work very accurately in difficult and narrow spaces inside the patient's chest, and which allows us to speed up recovery in patients. So patients have less trauma, less surgical trauma inside their body, and this enables them to recover from the cardiac surgery in a more rapid way. And that's what we have demonstrated in the past up until now. So you want to know which digital health solution can help us throughout the process and what actually the challenges are that we are facing in our daily life. And of course, there are technical challenges throughout the surgery, which we try to address with the most modern technologies like robotics. But also the post-operative stay is a very important part of the process. And we cannot just send the patient home without any follow-up, without any care afterwards. We need a proper entourage, a proper care around this patient. We need to prepare them up front. And if we prepare them correctly, we win time post-operatively. And if we do the surgery nicely, we know that we can send them home safely in a very early stage, but there are still things that need to be monitored. There are still wounds, although they are small, that need to be monitored. There is a heart rate that needs to be monitored. There is patient input and pain that needs to be monitored. We have many solutions, for instance, for pain and addressing the pain after surgery, but of course we need to be aware that the patient is in pain. So the communication is essential. We need to know what the patient is going through, what he is feeling, and then we can work. So we need something intermediary that we can also share with our other caretakers, like the cardiologists, like the physiotherapists, where we can interact with each other, the general practitioner, and where we can share information about the patient, and where also the patient can participate in the process. Which patients do we address? It's all kinds of patients. They're young, they're old, but they expect very rapid solutions, elegant solutions, which allow them to return to home or to their normal environment as soon as possible. So indeed, you want to know how this early recovery program started and how it came through. It started already a few years ago. We saw that quite some people are actually not needing to go to intensive care. They just need to be woken up and to have a close look on them, check everything. And we saw that just by waking them up directly, everything goes fine. And as a surgeon, you can check all the vital points that are important, but it's easier in a patient that is awake because you can talk to the patient, you can ask him whether he or she is in pain, and you know directly whether the vital parameters that you're measuring are clinically important, yes or no. If we then can reduce the hospital stay by 1 or 2 days, this is an enormous difference, and it can change the turnover in patients dramatically. You can treat the same amount of patients in 1 week or double it by smart ways and going through an ERAS program. So that is a much smarter way of usage of beds and of staff, and that is crucial in these shortage of days, I think. The next coming 6 months, it will be a very interesting year where we will grow a lot, where I see a lot of potential to further speed up our ERAS program, because now our ERAS program has magnificent results. We went down from 8 days hospital stay to 4 to 5 days, but we see further improvement, and most specifically because we want to enable the patients to recover faster. That is the only goal that is behind it. And the better that you are informed, the better all the problems or issues are tackled, the easier the process goes for everybody.